The National Education, Health and Allied Workers Union is going ahead with its planned Community Healthcare Workers National Strike. The union is calling for all community health workers to be employed permanently and for better working conditions. The strike will commence tomorrow and will run indefinitely until the employer fully accedes to their demands. Nehawu's Deputy General Secretary, December Mavuso, joins us now to tell us more about this. Mr. Mavuso, thank you so much for your time on eNCA this evening. So what is the strike about tomorrow? What are you planning?
Well, the strike tomorrow is an indefinite strike. It's a campaign for the permanent employment of the community health workers who are cadres that are doing a lot of work, to serve our communities in terms of health care. We know that today, since the pandemic has started, they're doing a lot of work. They're on the ground doing tracking and tracing of contacts. They now in schools screening learners, helping the Department of Education and so on. They've been doing a lot of this work for many years. So, and there's been discussions about making this job permanent. You know that even in the NHI papers, and the law that has been passed, community health workers are part of the ward-based primary health care teams together with other healthcare professionals. Yeah. But it is only them that are subjected to contract work, paid stipends, and with poor working conditions, that are not favorable. Yes, the fight is all about making sure that they are absorbed in the system and their conditions are better.
Have you been able to identify how many community workers need to be employed and permanently into the public service? And what do you understand to be the details of the announcement that President Cyril Ramaphosa made at the State of the Nation address, that we would see about 6,000 community health care workers and nursing assistants over the next 3 years? That 6,000, is it just the assistants and community workers, or is the 6,000 that will be absorbed in the public service?
Well, our understanding that the 6,000 is a combination of both the community workers and nursing assistants, which we don't know what is the split, between the two categories of employees. But it doesn't start there. For many years, we've been, discussing this matter with the Department of Health. At the time, it was estimated that about 40,000 of these workers are out there, some employed by provincial departments, paying them stipends, some employed by NGOs. The number could be far above that. But when we started the discussions a few years ago, the indication was that there's 40,000. We would look at gradually how those workers are taken on board until in 2018, where we signed an agreement with the department in the Public Health Bargaining Council, wherein it was agreed that we must work out the modalities, the standard operating procedures as we bring them on board, including what conditions you're going to employ them, whether it's salary level 3 or salary level 4 and so on. And that was supposed to happen within a space of 12 months. Unfortunately, government came back in 2019, asked for extension of the agreement, of which we agreed. They failed again early this year to present any details in terms of how they look at this matter, and they requested the further extension, which we disagreed. Hence, we ended up in a dispute, which has brought us here today.
Yeah. So if you really go ahead with the strike and you're pushing for these community workers to be absorbed as permanent employees, that would mean that they must get the full employment benefits. And we're talking here about pension fund, medical aid benefits, housing allowance, etc. How is this going to be the case? Where is government going to get the money to pay them? Already government is talking about cutting the public sector wage bill. So they would argue this is not a good time to be even talking about absorbing more people into the public service.
Well, it will be surprising. Yes, we hear that argument about the huge public wage bill, which we disagree with Treasury. I'm sure it's a debate we can have. But as long as you need them, because they are currently out there, deployed out there, they are working under very terrible conditions. They're working whether it's raining or whether there's heat. They are walking the streets, the rural villages. They're in the townships. They are everywhere. So you need them. And when money was set aside, if you remember, actually, during the lockdown, whether it was at level 4 or level 3, there was an announcement that 20,000 of those workers will also be employed. We don't know what they've done today, except that Gauteng, the former MEC of Gauteng, Dr. Mandela Masubu, had indicated that Gauteng would take 8,000 of those. They started the process. We know that now a number of them, they've been placed at salary level 2 in terms of the salary scales in the public service only in Gauteng. The rest of the other provinces, they even failed, most of them, to place them at the minimum wage level, which was agreed with them in 2018, that as a start, put them at the minimum wage level of 3,500. Some they did, some they did not. So it's all about planning, because these are health care workers who, during this pandemic, it has been proven beyond reasonable doubt that you need them, just like we need nurses, that we need assistant nurses and other categories of employees.
Yeah. All right. December Mavuso, I really appreciate your time on eNCA this evening.